Hello, everyone. Welcome. Today, we're going to look at pacemaker activity, how the heart creates that pace that it uses to pump the blood, and we're also going to look at uh, some discrepancies within that pacemaker activity as well, problems within the heart as it's beating too fast, too slow, heart arrhythmias, and so forth. So, we're going to look at how the heart creates this pacemaker activity and what is going on there, as well as studies that have looked at examining how artificial pacemakers work. And we're going to get started right away. So let's look at, first of all, the cellular basis for this pacemaker activity, and we're going to focus in on what's called the funny channel. This particular area was discovered in the 1970s, and the reason it is called funny is because it behaves differently than other muscle cells within the body. So normally we're looking at an exchange of sodium and potassium, and instead we've got these funny channels that are also using sodium, potassium, but also creating calcium as well, and shuttling this in and out of the area to give the heart its pace, the way that it beats. Also interesting to note is that changes in heart rate are not controlled by the heart itself, but are controlled by the endocrine system. So we look at two systems working in tandem with one another. So this funny channel is shuttling in and out various positive ions, and it remains that way for quite some time. It creates this wonderful plateau, which helps with tetanus, as well as making sure that the blood pumps properly. So here's an example of that in the SA node and the different channels we have, the sodium as well. Here's the SA node, the Purkinje fibers, and how they operate in tandem, the change within the volts, and so on and so forth. So that's more or less how this is working on an electrical basis, as well as on the very micro scale. It is also interesting to note that this particular activity occurs outside of receiving stimulus from the nervous system. The heart is able to kind of have its own signal that allows the heart to beat, so its own electrical impulse that is separate from the nervous system to continue to let it fire. Now, of course, heart rate and the heart itself is more or less controlled by an involuntary system within the heart. Let's look at the more gross anatomy of this. So this is the cellular and graph basis of how this works on an electrical standpoint, and now let's look at where this sits throughout the heart so we can get an idea. So here we have the heart itself. Within that we have our AV node, the bundle of His, and Purkinje network. So these fibers all around the heart here are the ones that are controlling that pace, and they're the ones that are making the heart contract and pump the blood in and out where it needs to go, so that the body can receive oxygen and renew that oxygen, as well as send it to the kidneys for filtering of waste and so forth. Also going to look at when the heart is not functioning the way it should, and what is done to design the designs that we have created to make it work the way that it should. And usually what you're looking at is an implanting of an artificial pacemaker. This is what this looks like. So here's your pacemaker here. Has its own electrical current, again separate from the nervous system, and this pacemaker is then implanted here and then throughout the heart to stimulate the fibers and the areas that we are talking about to maintain that regular heartbeat. And of course, right now this is working wonderfully, although there is some new research that is giving us the opportunity to maybe improve the function of the pacemaker, or in fact, maybe in the future, to get rid of the pacemaker altogether. One other thing of note that I had not mentioned yet is how the heart muscles actually work, the cardiac myocytes actually work. So they're shorter than skeletal muscles, not as long and cylindrical. They are in bundles together, but instead of operating separately, these actually cause a cascading effect to make the heart contract and send that message to all the other cells within the heart to have this wonderful cascading effect. Now, the design of the heart muscle is such that it doesn't tire very easily, such as skeletal muscles and so forth. So it operates very differently. It has this wonderful plateau to keep the electrical positivity and negativity working, so that it has the firing and normal regular heartbeat. Now, of course, the main problem is when we're getting those arrhythmias. Again, as you can see with this is there to make sure that pacemaker is there, and some interesting research that we're looking at has targeted the pacemakers within the heart. So we're looking at medications that are designed to help the heart regain its normal and regular heartbeat, and they attack the funny currents, the bundle of His, and those Purkinje fibers to help maintain that regular heartbeat. Now, we're also looking at ways of hopefully stimulating that area as well, so we don't need the pacemakers. Now, another thing that we're looking at too is with continued problems with the heart, medication may not be enough, and that previous slide that we looked at that has a pacemaker implanted into the body, which is has its limitations, but we also have to have someone, a cardiologist, look at how effective this is, how effective the pacemaker is, and over time what we need to do to monitor it correctly. So as we look at this, one of the things that we also has been done in research is we're looking at atrial fibrillation in patients that have pacemakers implanted. So in this case, we're looking to see what the percentage, the proliferance of atrial fibrillation is, and how effective those pacemakers are, and whether or not we need to make adjustments. And both of these pieces of research have been done within the last 4 years, and the results are very interesting. So in this most recent study looking at atrial fibrillation in patients with pacemakers, the most recent research that they've done found that they looked at different patients, some that had a history of atrial fibrillation, and that's why the pacemaker was implanted in the first place, and those that did not have a history of atrial fibrillation that also developed issues with arrhythmias and so forth. And what they discovered is that out of the 68% of their study sample showed that half of them had previously had atrial fibrillation, and in other studies they looked at saying that 50% of those studied did not have a previous history of atrial fibrillation, and 50% began to show atrial fibrillation with those that they tested. So fascinating research looking at, I guess, the durability of pacemakers and some of the issues that we are facing in keeping and monitoring how that works. So the machine that we have to use for pacemakers, those things that you have implanted in your heart, are now showing they don't always function the way that they should, and they can cause issues throughout extended use. It would be interesting to see whether or not there is a way. It would be very fascinating to see if there is a way where we can not only target the pacemakers within the heart with medicine, but those that are having issues with atrial fibrillation as well as other arrhythmias and so forth, is to look at ways to actually target those areas so that the heart fixes itself, not necessarily with medication, but a way to communicate with those cells that are misfiring in a way to give the heart an abnormal heartbeat to have it self-repair. This has been done in other areas with limited positive results. It would be fantastic if we could find a way to make that work in other areas of the body as well. It's going to take a lot more research and a lot more study to make this work, but if this happens, then we eliminate the need for invasive surgery for pacemakers, and the body can repair itself, and I think that is the ideal. So anyway, here are the references that we looked at for not only the images that are seen throughout the presentation here, but the studies that were done here targeting funny currents, and here looking at the frequency of atrial fibrillation and whether or not there's a risk of stroke in those areas, and more on those references as well. So all the different types of credit where credit is due. Again, thank you for joining me, and we will talk to you again.